Yeah. Good morning. Thank you all for being on. First of all, Denisha, could you do a roll call for us, please?
Yes, Chairman. Norman Boyd,
Here.
Elena Cummings,
Here.
Kenneth Davis, Russ Childers,
Here.
thank you. Roger Folsom,
Here.
Anthony Williamson,
Here.
Mark Trail,
Here.
Russell Crutchfield,
Present.
David Cruz,
Here.
thank you. And I will ask again, Kenneth Davis. That concludes my roll call, Chairman Boyd.
Thank you, Denisha, and thank you for the board members for being on this morning. We have a quorum, so we can conduct business. We don't have a long agenda this morning, so we'll move right through it. And thank you for being here. Commissioner and I are here in the boardroom, and I'll call the meeting to order and ask for Elena Cummings to, if she does, recommend approval for the minutes of the October 8th meeting. Elena, have you had a chance to review those, please?
Thank you, Chairman Boyd. Yes, I have reviewed the minutes from the October 8th meeting and find them to be accurate as written and would make a motion to approve.
Is there a second to that motion?
Second.
Russ Childers has seconded that motion. All in favor say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, the minutes of the October 8th meeting are approved as written. Thank you, Elena. And with that, I will turn it over to Commissioner Berry for his report.
Thank you, Mr. Chairman and members of the board. Thank you for your participation today. Quick update. I wanted to let everybody know that earlier this week, we had a conference call with many of the hospitals that have been receiving the staff augmentation. Governor Kemp was able to support and push through ongoing staff augmentation dollars that will run us through December 31st. That is when the current CARES funding ends. So I want to certainly recognize Governor Kemp and his team for the support on that. The hospitals could not have been more thankful for that level of support that has been coming. Anna Adams, once again, coordinated that last-minute conference call with those hospitals, and I want to certainly recognize her leadership with the Hospital Association. That augmentation has been going on almost since the last week of March. And Joe Hood and Mario Ellis, Sean Walker, and the team from HWL, Jackson Healthcare, Charlie Evans have really not let us down one time in regards to getting staff to critical need hospitals. While the rest of the state has been seeing numbers increasing, the hospitals really have been the ones that have caught the brunt of that. So again, want to recognize the frontline workers who have been dealing with this on a day in and day out basis, and the uncertainty of whether or not they'll have staff to be able to treat the patients. So this carries us through December 31st. So we're very pleased with that. It gets us through the holidays, particularly Thanksgiving and the holidays around the latter part of December. So that was a big relief to those hospitals. That's the big update from our end. We continue to work with CMS on a variety of different issues related to long-term care facilities and how we do visitation there, along with waivers that impact how we continue to do telemedicine and working closely with CDC and public health to make sure we're following those guidelines. The last thing I'll say is wash your hands, social distance, wear a mask, and try to avoid large gatherings over the holidays. If you are going to have a large gathering, try to do that outdoors. Again, working closely with Dr. Toomey and her team at Public Health to convey that message. So if you're listening to this and can convey that to other people, please do so. Mr. Chairman, I'll turn it back over to you unless there's any other questions. Thank you.
Thank you, Commissioner. Are there any questions for the Commissioner or comments from the board, please? Hearing none, we have, thank you for that report, Commissioner. Thank you very much. We have one item on the agenda today to consider at the conclusion of this for initial adoption. It's medical assistance plan, the comprehensive support waiver program and waiver renewal. And we'll ask Lynette Rhodes, Executive Director of Medical Assistance Plans, to make that presentation. And you have received material on this as board members in advance. So Lynette, please proceed.
Good morning, Commissioner Berry, Chairman Boyd, and board members. Thank you for the opportunity to present. Today's presentation, Chairman Boyd, is a joint presentation from both the Department of Community Health and the Department of Behavioral Health and Developmental Disabilities. Ronald Wakefield, the Director of Developmental Disability Services, and Ashley Caseman, the Director of Waiver Services, are both present and will assist with any questions from the board. They are both employed with the Department of Behavioral Health and Developmental Disabilities. Pending initial adoption from the board and approval from the Centers for Medicare and Medicaid Services, we are proposing to amend the Comprehensive Supports Waiver, which is known as the COMP waiver, and the new option waiver known as the NOW. The Comprehensive Supports Waiver and the new options waiver programs provide community-based services to individuals with intellectual and/or developmental disabilities. The Comprehensive Supports Waiver and the new option waivers are 1915C Medicaid waivers, which must be renewed every 5 years. Chairman Boyd, I will begin with the proposed changes to the Comprehensive Supports Waiver. The Comprehensive Supports Waiver will expire on March the 31st of 2021, and it must be renewed. In preparing for the renewal, the following. First, we are proposing to discontinue the following services: community guide services, and the second is natural support training. We are proposing to discontinue the services due to the extremely low utilization of both services. The community guide services are designed for someone who is directing their own care in what we call the participant direction option. The community guide provides guidance and helps the member to understand things such as provider qualifications and record keeping. And it helps to improve the member's knowledge and skills to help them better manage the participant direction option. The natural support training services provide training and education to individuals who provide companionship, unpaid support, or supervision to enrolled members. Again, we are proposing to discontinue both services at this time. Second, we are proposing to add one new service, which is assistive technology. Some examples for the board would include things such as electronic speech aids, motion sensors, large keyboards, or telecare devices to assist with medication management. Thirdly, we are proposing to set maximum daily authorizations for two services provided in the COMP waiver. The first, Chairman Boyd and board members, is additional staffing. Additional staffing services are used to supplement existing staff hours and services. Currently, there is no limit or cap on the number or amount of additional staffing hours a member may receive. Thus, we are proposing a daily maximum or a cap of 6 hours. Thus, a member may request and receive up to 6 hours of additional staffing. For those individuals who are receiving in excess of 6 hours today, we are proposing an 18-month transition plan. This 18-month transition plan will allow ample time for the member to plan and transition to other available services. We are also proposing to place a cap or a maximum limit on the number of skilled nursing services an individual can receive. And this applies to skilled nursing services from an RN or an LPN. We are proposing a 16-hour per day maximum or cap on skilled nursing services. For those individuals who are receiving in excess of the 16 hours, we are proposing an 18-month transition plan to allow the member ample time to plan and transition to other available services. Next, we are proposing a rate increase for interpreter services. We are proposing to increase the rate for interpreter services from $19.38 to $23.35 per 15-minute unit. Next, we are removing the participant direction or self-directed option for 2 services. The 2 services are behavioral support services and supported employment services. I will address first the behavior support services. Behavior support services require the provider to possess a professional license or a certificate. As a result, behavior support services may only be delivered by an enrolled Medicaid provider. I do want to clarify that the services will still be available to members, board members, but not through the participant-directed option. As it relates to supported employment services, this requires specialized training in employment options and the ability to customize an employment setting. Members will be able to access supported employment services, but not through the participant-directed option. Those are all of the proposed changes for the comp waiver. I will now shift to the proposed changes for the new options waiver. While the new options waiver will expire in 2022, we are moving forward with amending the waiver so that the services will be consistent with the comprehensive supports waiver that we just discussed. With one exception, the changes for the new options waiver will mirror the proposed changes for the comp waiver just reviewed. Thus, we're proposing the following. Again, we propose to discontinue community guide services and natural support training. We're proposing to discontinue the services due to the low utilization. Second, we're proposing to add one new service, which is the assistive technology service. Third, we're proposing, again, a rate increase for interpreter services. The rate increase will be $19. It will be an increase from $19.38 to $23.35 per 15-minute unit. And we are also removing the participant direction or self-direction option for behavior support services and supported employment services. Those are the proposed changes for the now waiver. I will now move on to discuss the financial impact. I will start with the expenditures for the proposed changes to the now waiver. For state fiscal year 21, and this is for the time period of April through June. For the service, and this is the new service of assistive technology, the total funds impact for state fiscal year 21 will be $139,810. State funds represents $46,095. Federal funds represent $93,715. For the rate increase related to interpreter service, there is no financial impact. For the services related to community guide and natural supports training, I'll address those individually. These will both result in a decrease or a reduction in cost to the state agency. For community guide services, $382 is the reduced amount or reduced financial expenditure. Of that, $126 represents state funds, $256 represents federal funds. For natural supports training, the total reduction is $786. Of this amount, $259 represents state funds, $527 represents federal funds. I will now address the expenditures for state fiscal year 2022 for the now waiver. For the new service of assistive technology, total funds is $561,631. Of this amount, $185,170 represents state funds, $376,461 represents federal funds. For the rate increase associated with interpreter service, there is no fiscal impact. For the changes associated with community guide services, there will be a reduction in the amount of $1,528. Of this amount, $504 represents state funds, $1,024 represents federal funds. For natural supports training, there will again be a decrease in expenditures. The total funds is $3,144. Of this amount, $1,036 represents state funds, $2,108 represents federal funds. I will now address the expenditures for the comp waiver. For state fiscal year 21, which again is the period from April through June, for the new service of assistive technology, the total funds is $261,696. Of this amount, $86,281 represents state funds, $175,415 represents federal funds. For the changes related to additional staffing and community living support services, and again, this is placing the cap on those services, there will be a reduction in expenditures of $2,039,660 total funds. Of this amount, $672,476 represents state funds, $1,367,184 represents federal funds. For the changes associated with the cap that will be placed on skilled nursing services, there will be a reduction in expenditures in the amount of $1,095,001. Of this amount, $361,022 represents state funds, $733,979 represents federal funds. For the rate increase associated with interpreter services, there will be no fiscal impact. For the changes associated with community guide services, total funds, and this will be a decrease in expenditures, is $7,986. Of this amount, $2,633 is state funds. $5,353 represents federal funds. For the changes affiliated with natural supports training, there will again be a decrease in expenditures in the amount of $7,146. Of this amount, $2,356 represents state funds, $4,790 represents federal funds. And lastly, Commissioner and Chairman Boyd, I will address the fiscal impact associated with the comp waiver for state fiscal year 2022. For assistive technology, and this again is the new service, there will be a change in the amount of $1,044,395. Of this amount, $344,337 represents state funds. $700,058 represents federal funds. For the changes associated with additional staffing, this will result in a reduction in expenditures in the amount of $8,158,641. Of this amount, state funds represents $2,689,904. Federal funds represents $5,468,737. For the changes associated with the cap that will be placed on skilled nursing services, this will result in a reduction in expenditures in the amount of $4,380,000. Of this amount, $1,444,086 represents state funds. $2,935,914 represents federal funds. For the rate increase associated with interpreter services, there will be no fiscal impact. For the changes associated with community guide services, there will be a decrease in expenditures in the amount of $31,941. Of this amount, $10,531 represents state funds, $21,410 represents federal funds. And lastly, for the changes associated with natural supports training, there will be a reduction in expenditures in the amount of $28,583. Of this amount, state funds represents $9,424, and federal funds represents $19,159. An opportunity for public comment will be held on November the 18th, 2020 at 10:30 a.m. via WebEx. Chairman Boyd and board members, I will pause now for any questions.
Are there questions or comments from the board?
Mr. Chairman, this is Mark Trail. I do have a few questions, please.
Yes.
Ms. Rhodes, first of all, and it may be some of the BHDD folks can answer this as well. I want to ask a question specifically about the skilled nursing, I believe it was, and the comp waiver. So assuming these were medically necessary services in the first place, which I believe is reasonable to assume, skilled nursing is a pretty important service. Where will they be getting this service? What other services do we think it is that they're going to be getting instead of skilled nursing?
Sure. So I have with me Catherine Ivy, but Ron and Ashley, if you guys could chime in on the response as well. Catherine, do you want to?
Yes, I'll start. Good morning, Mr. Trail.
Morning.
I'm going to respond to your question by just clarifying the fact that, sorry, I'm getting a little bit closer to the mic so you can hear me. I want to first respond to the specific question just by a little bit more information. The reductions in service to skilled nursing and additional staffing, for example, really just apply to individuals who are living in the community in their own home or in the home of a family member. They do not apply to residential settings, in group homes, or in host homes. And so presumably these individuals would have the services, the nursing services available, just in a different setting.
Okay, if I might ask a little bit deeper on that, Ms. Ivy, they're in the home and they're getting skilled nursing services, presuming they're needed. Where would they get? It says that they get other services in some of the overview here. What would they get?
The transition plan has been designed for CMS approval based on an 18-month review of the care plans and exploration of all other services available. The presumption is that they would be able to get those services if they lived in a family home, specifically by the family, or because they would still have 16 hours of service available. Or perhaps if they lived in their own independent setting, they might need to transfer to a different location, a different community location. And I would ask DBHDD if they'd like to respond any further about the planning around that.
Catherine, thank you. This is Ron Wakefield, and Mr. Trail, good morning. To members of the board, good morning. Catherine was absolutely correct when she started out and explained the definition, and that's an important component of this. Community living supports technically is a service that is rendered in someone's own home or in a home that they own or lease. And what's happening currently is, say, someone with medical needs, complex medical needs, is living in his or her own apartment, and they require 24/7 nursing support. That's the situation we're trying to address. So there are options. There's no reduction in the need for that level of services. We're not reducing the service. All we're saying is there are a couple other options that should be explored in terms of where that service is delivered, and it could be shared. You could share your home with someone else, or we have other living arrangements that could be just as suitable. But the point is, we will not reduce, take away the medical supports that person needs.
If I might follow up again, I'm sorry. I feel like we've kind of shifted from skilled nursing to community living support in the conversation. And my question related specifically to skilled nursing. I understand community living support services can be provided by different folks. Skilled nursing, on the other hand, that's a little more complex. The root of my question is this, and maybe it's a question for DCH, I don't know, but are we concerned that this is a shift, a cost shift, from the waiver to possibly home health services, for example? And if that is the case, or could be the case, do we think that we would need to modify the DCH budget in order to accomplish that? It was several $1 million. I don't remember, we got a little mixed up here with the number of millions being cut, but that's not insignificant.
It's definitely not insignificant, Mr. Trail. I think that the 18 months of transition will allow DBHDD as the operating agency to explore many different options for individuals. One of which is that, as we know, much skilled care is actually provided by family members. And so I believe the idea is that some of this might shift back to family members, but that's a presumption on my part. I'm going to defer to DBHDD to see what their plans are, particularly with regard to the skilled nursing. I don't see it actually transferring to home health, simply because the nature of home health services is such that it doesn't allow for long visits, nor does it allow for more than 1 hour in one particular day, since it's a rate per visit versus per hour.
Well, I'll look forward to public comment, but I will note here that I do have some concern that this is an actual reduction in service, and some of the comment from BHDD would suggest that folks might even need to change their living situation, which concerns me when we consider what the whole purpose of the waiver was in the first place. So I'm looking forward to the public comment on those matters.
Thank you, Mr. Trail. We are as well.
Are there other questions or comments? I have one overall question. From my understanding, what is driving this proposal waiver? Is it based on past experience that we're capping hours, which seems to be where a lot of the savings are coming in, and that's good? Is that based on experience? Is this change being driven from top down from CMS, or is it being benchmarked against what other states do? What is the driving force behind these changes in a general nature?
This was not a directive from CMS, Chairman Boyd. This was based upon experience and our research on what is actually happening in the community. And Ron, I would like for you to chime in on this, since you guys did a lot of the data analytics surrounding this particular issue.
Yes, thank you. Chairman Boyd, you're absolutely correct in terms of it's based on past history. And sorry, there's a lot of feedback. I'm not sure. Okay, that's better. Thank you. Yes, it's based upon analysis and review of the past number of years and utilization of this service, and the need to recognize that if we do not have caps in place, we have over 6,500 people currently on the planning list, and we've had close to a 268% increase in this one area. And if we do not do something about it, we're going to face an emergency down the road in terms of how many additional people are we going to be able to serve.
Very good. I commend the review process, and nice to look for savings. So any other questions, comments? We'll look forward to, if the board approves here, we'll look forward to the public comment, as Mr. Trail has indicated. Is there a motion to be made for approval for initial adoption? Would someone move for initial adoption?
Muted.
Move for adoption.
Is there a second to that?
I'll second this. Trail.
The motion has been made for initial adoption approval and seconded. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. And thank you, all of you, for a very good and comprehensive presentation this morning. Thank you for doing that for us.
Thank you.
With that, as I said, our agenda is pretty short this morning. Is there anyone that knows of any new business that needs to come before the board at this time? Hearing none, I will call the meeting adjourned. Our next meeting will be on December 10 at 10:30 a.m. And thank you so much for joining the call this morning. And hope you all have a very good Thanksgiving, even though we're probably not going together with as many family members as we have traditionally at this holiday. But we'll look forward to more positive things in that regard in the future. Thank you so much. Goodbye.
Thank you.